is Dr. Kate Eckert, and today's episode is how we can use our different therapies for kids. So we don't use all of our extra therapies on kids, but we do use some of them, and depends on different scenarios. For myself, my own kids are 5 and 8, and I have used laser therapy on both of them for a variety of things. I've used laser therapy for my daughter for sprained ankle. I've used it on my son to heal a cut or wound more quickly because of the different things that laser does. So laser is really great with reducing inflammation, speeding up healing, wound healing, that kind of thing. It increases circulation. It's really good for getting the cellular processes moving, and that's what makes it speed up healing. So I have used it multiple times for both of my kids, and they're on the younger side. It is not scary, it's not uncomfortable, it doesn't make a weird noise. It doesn't make any noise at all, actually. It's just a red looking light, and it feels a little warm to them. And usually we use it on a pretty low setting so that it doesn't even feel that warm. They don't mind it, they like it, it's not a big deal. In the office, we treat kids weekly, and we often use laser for them if they were in a sporting event, they just had an acute fall or a sprain or flare up, that's something like that. If they're coming into us and they want to get right back into their sport, they might be utilizing NSAIDs like Advil, ibuprofen, Aleve, those kind of things. So if they're doing that and they really want to just get back into their sport as quickly as possible, we tend to lean towards doing laser therapy because they can still use the NSAIDs that they want to and continue playing their sport. Now, do we recommend that? Is that ideal? No, that's not ideal. It would be ideal for them to skip the NSAIDs altogether, don't mask their issue, and really get to the root cause and treat it more aggressively. But we are not here to totally tell you what to do and enforce it that way. But we do have kids that are willing to not take NSAIDs and try out Shockwave. So we treat a lot of swimmers, throwing sport athletes, wrestlers, runners. All of those sports have a variety of different issues. Low back pain, neck pain, shoulder injuries, plantar fasciitis, shin splints. The list goes on. And we treat those injuries just like we would with an adult with shockwave therapy. And then we'll add in laser to speed up their healing, because usually they want to get right back into the sport or activity that they are into. So the good thing about kids is that they really respond much quicker if they're willing to rest. So if they're willing to take all of our advice, rest a lot, do these therapies, they typically respond much quicker than adults. And that's because their cellular metabolism on their own is much quicker than ours, and we love that for them. However, if they really are hell-bent on sticking to their sporting schedule, it's going to take longer, especially if they're going to take NSAIDs in between. A lot of times they will not take an NSAID 2 days before or after their treatment, but they will in between the week on those off days. That's not ideal. We tell people that up front. That's like the least that you can do that will still treat you, but that isn't our ideal. Our ideal is that you don't take any NSAIDs and you rest while you're getting treated. So we really want to give the body time to heal, that kind of thing. The other thing we see kids for a lot would be for headaches, stress-induced things. So we've treated quite a few kids that have TMJ and headaches. And for TMJ and headaches, we always check the front of the neck, the jaw itself, and then we laser those areas in through the temples. And we see really great results with stress headaches with those therapies. And it works great for adults. It also works great for kids. We have worked with some younger kids that have more unique circumstances, that have tendon issues and that kind of thing. And I am always willing to take what the parent gives me, what their issue is. It might be more rare. I've researched things that they're doing at CHIP Hospital in Philadelphia with Shockwave in a hospital setting for kids with these more rare issues. I take that data, I look at the settings that they use, I look at the treatment plan that they use, and I mimic that, and we have seen good results with that. So it's always good to have someone that, even if you don't have experience with treating that condition, looking into the research, finding some good case studies, seeing how those worked out, what age, what frequency of treatment, that kind of thing, and then applying it to your own patient. So I found we've had good success with that. So even if it's not something that you hear us talk about, I'm always willing to research it and look into it for you. We find that, especially for our headache TMJ patients and our athlete patients, these therapies just really do the trick. There's so much quicker in effectiveness than just chiropractic care by itself. Now, most of these kids also get chiropractic care at the same time, and we really do recommend that. And when we get patients in that might have been getting chiropractic care from somewhere else, we definitely recommend that they continue their care with their existing chiropractor if they want to stay there, because we do think that they dovetail nicely together and give a better result. So we are big proponents of using the different therapies synergistically, whether it be just at our office or combination, with other offices. We like to collaborate and get kids feeling better quickly. So if you have an athlete that is maybe a little off their game, this would be the perfect adjunct to really get them performing at their absolute best. So if you have any questions about injury or anything like that that you want addressed, feel free to reach out to me. I would love to go over that with you.